Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. We have an exciting program here today, and what it's called is Therapeutic Massage. What we're going to be spending the half an hour about is talking about different aspects of massage, their therapeutic benefits, and demonstrating different forms of massage and demystifying a little concerns that you as the viewing public may have about whether massage and medical massage is good for you. I'm a really large proponent of medical massage and have been getting massage therapy myself every 2 weeks for about a 25-year period of time. We've all heard that saying that, you know, on my tombstone I don't want it to read like, "I wish I would have worked more." Well, one day I'm going to be dead, and when I am, I'm never going to say, "I wish I didn't get that much therapeutic massage." I know I won't. So today we're going to take it right from the back from the very beginning and start to integrate this into your mind of where you think it might fit. I've been in clinical practice dealing with musculoskeletal problems for the past 27 years. I've always had massage therapists working in conjunction with me in my office. So what we do is that if I think of a person needs a massage or needs a regional massage or a therapeutic loosening up of the musculature prior to the nature of my chiropractic care or acupuncture, we've integrated that into the components of what's going on. I was trained out on the West Coast, and in California and on the West Coast, 20 years ago, people had already integrated massage into their lifestyles to a much greater extent than anyone's ever done on the East Coast. Now, with the advent of good schools right here in New Jersey, we're finding that there is a tremendous amount of well-trained, good learned massage therapists that can give you a lot of benefit. Now, for people that have never had massage before, in talking to them, I find that a lot of people wanted to get massage, but were concerned about issues of their surroundings, or would they have to get totally naked, or, you know, feeling uncomfortable about how they're going to be exposed. Is it going to be a man? Is it going to be a woman? All of these things are aspects that you can find out ahead of time. Like in my office, we have men and nurses and women that do massage therapy. And sometimes women are more comfortable with having men do massage. Sometimes women don't want men touching them. Sometimes men that are getting massage don't want a guy working on them, and vice versa. If that's an aspect that can very easily be overcome. Most people that have good experience with massage therapy, though, are just interested in really, really good massage. So it doesn't make any difference whether it's a man or a woman. Now, when a person comes to get a massage usually, when we're talking, is an hour session. Sometimes people will get a half an hour massage, and when they do, it's usually for a regionalized area. Let's say they want their neck and mid-spine worked on. So a half an hour is a good period of time to really, really get in there and work these areas out. Some people want like a full body massage, and that usually takes an hour, if not more. Now, by full body massage, I mean no one's massaging in and around intimate areas or areas that are going to make anyone feel uncomfortable. Normally, when women come into the office, we have a special pair of modesty shorts that they put on over their underwear. And then we have either a gown that they can put on, or the way in which they're laying down on the table, that the massage therapist has drapes that they put over the person. So only the exposed area that they're working on is being exposed at the time. It's nice to have a comfortable, relaxing environment, nice music, comfortable temperature, and of course, you know, a good therapeutic approach. What we're going to do in a moment, I'm going to introduce to you a great massage therapist, Kevin Kehler, who's decided to come in and demonstrate some different massage techniques here today. And before we do that, we're going to talk about the benefits associated with therapeutic massage. Stay with us. With me here today is Kevin Kehler, a licensed massage therapist who works at Somerset County Alternative Medicine, was a graduate of Somerset School of Massage, and has been in clinical practice for the past 5 years. I've personally had the opportunity to get massage therapy from Kevin, and he's an excellent massage therapist, and I thought he would make a great component to bring on the show today because he has command over many forms of massage therapy. Kevin, welcome to the show.
Thanks very much. I'm very excited to be here.
Yeah, thanks. What I wanted to ask you first, give us a brief overview of some of the more popular forms of massage therapy that people request, or give them a little overview of that.
Okay, clearly the most popular is the one that you see probably on TV and in movies the most, is a relaxation style massage called Swedish massage. As you were describing earlier, it's a full body experience, starting with the scalp and face, neck and shoulders, arms and hands, occasionally chest and abs, chest only on men, legs and feet, and then you flip it to the backs of the legs, and the back, of course, everybody's favorite is usually the back. You use some sort of a lotion or an oil with this type of massage. It's usually very quiet, very relaxing, and it can be very soothing. It's sort of a mind-body experience. Okay. It's a relaxation style of massage. The other styles that are available and popular now are more of a deep tissue, more therapeutic or rehabilitative style, like a myofascial release or neuromuscular therapy.
Okay, would that like sports massage? When people say sports massage, that's usually the component.
Sports is actually one of the most misunderstood styles of massage. It involves a lot of stretching. It takes place usually during, right before, or right after an actual event. So if you were to come into the office and say, I'd like a sports massage, you may be asking for a type of massage that is inappropriate at that time. It may or may not.
So that's when the massage therapists go to the event, have their table set up at that time.
Yes. Or if you saw any of the U.S. Open, a lot of times between games you'll see someone coming in and rubbing down the legs. It's on site at the event, just before to warm up and loosen up and get the blood flowing, or just after to sort of move the lactic acid out and calm the heart back down and move the blood around after an event.
Well, I wish that I got that every time after I exercised every time. That'd be awesome.
Me too.
Now, what about shiatsu? What's that?
Shiatsu is something I think it falls into sort of a third category. I usually say there are two basic categories, but there is a third category. There's a relaxation style, there's the therapeutic or rehabilitative style, and then there's sort of an energy work style. Shiatsu, I do not practice it. I was actually thinking of taking the courses in it. But it has to do more with Eastern thought, with the meridians, and more like acupressure and things like that. And it's more of an energy work. There is hands-on, and it is very manipulative, but it's sort of a hybrid between an energy work and a therapeutic and a relaxation altogether.
Now, when people talk about trigger point therapy, or trigger point massage, what's that?
Trigger point massage. I do something called neuromuscular therapy, and I'm going to back up actually just a moment. Myofascial release, which I mentioned before, is a form of deep tissue massage, usually not done with any oils or lotions or anything like that, to get the most amount of friction and get the most movement and manipulation of the soft tissue. The reason for this is well, there are many reasons, but a deep tissue massage, really the goal is to change the condition of the tissue. So if you come to me with a stiff neck or an inflamed this or a sore that, you really want that to change when you're finished with the treatment.
Yeah.
So a deep tissue like myofascial release is a very broad. You say like my quads hurt because I just ran a marathon or something like that. We would do a deep tissue treatment on the quadricep muscles. Neuromuscular therapy or trigger point massage, which you were mentioning before, it goes one deeper than that. It's very specific to the individual muscle fibers and individual points on the muscle fibers that are tight or damaged or inflamed in some way, causing some sort of pain, not only at the site, but trigger points can often what calls refer pain. Referred pain is very common, to experience a sensation somewhere else near or approximate to
a radiating pattern.
A radiating pattern,
yeah.
Approximate to where the actual pain.
So part of the goal there is to actually re-educate some of the way that the muscles function.
That's exactly right. There's a pattern interrupt. The reason it's called neuromuscular therapy is because there is a neurological pattern that's happening in the muscle itself, and a good therapist will come in and interrupt that pattern, cause the muscle to relax and release, the trigger point release, and therefore the pain and even the referred pain will diminish.
Yeah. Well, I know that not a lot of people come in per se, particularly for abdominal massage, but can you tell us a little bit about that?
Abdominal massage, your abdomen is a muscle just like any other muscle, and it's probably, for some people who do crunches all the time, it can be one of the tightest in the body and cause variations in posture, which we know chiropractically is not necessarily a good thing. And for others, it's one of the more neglected. Nobody likes to do crunches, so they let them go, and they get too loose, and of course that can affect the back as well. So the abdominal muscles are treated just like any other muscle. On a female, that is possible to do abdominal. On a female, you simply drape over the breast tissue and expose just the abdomen to do the massage, and you do a treatment. You can do Swedish relaxation techniques, you can do deep tissue techniques, and you can even do trigger point release on the abdominal muscles.
Yeah. The reason why I ask is that some people come into me for visceral manipulation, and what I find is that in certain cases, the patients didn't need so much my attention specialized in loosening up some of this connective tissue as much as I felt that they really just needed a good, abdominal massage, working this out, whether they have chronic constipation or constrictions into there, or even irritable bowel. Sometimes relaxing, mechanically relaxing these areas seems to make such a big difference for them. Let's talk for a moment about the therapeutic aspects of massage. I mean, what is a person getting out of it, separate from feeling good and relax the muscles?
Well, ultimately the goal is one thing. It's oxygen and it's blood. Bringing blood to the area to bring good oxygen. All of your health depends on bringing in the good. You want good air to breathe, and good oxygen and good nutrition in your system, and everything else. Bringing in the good and getting out the bad. And so what massage does is just sort of stimulates the blood flow, loosens up tense muscles. Tense muscles can constrict blood flow, causing not only the blood not to flow, but it's almost a double negative, if you will, because if a muscle is tight and damaged and it's not getting blood flow, it's not going to heal. So it's sort of self-perpetuating. And what a good massage would do is open up, loosen those muscles, bringing in good blood flow, causing the body to do what it does best, and that's heal itself.
A big thing, and a major reason why I'm a proponent of it is that from my studies, I find that many internal diseases and disorders represent themselves on the surface of the body first, and that may be tension in the mid-spine, referred pain into the arm, around the scapula, into the lower back, or into the buttock area. And by actually working these areas out mechanically, I mean, there's a lot of things a person can do on their own, such as stretching and this and that, but as far as the actual hands-on form of therapy to get in there and to work these areas out actually helps to prevent underlying disease and disorder. The other thing, and I feel really strongly about it, is that people that have arthritic conditions and people that are diabetic, they need regular massage to help to promote the circulation and the flow of fluids, or people that have circulatory deficiencies into their legs or arms. They need this tissue to be mechanically manipulated and worked out, so that just what you're saying, you're bringing in the good and you're bringing out the bad. We could talk specifically about lymphatic flow and electrolytes and lactic acid and abnormal metabolites. But really the core of it is the in with the good and the out with the bad. Now, some people call on the phone, they'll say, do you do a lymphatic massage? And, what's that?
Well, again, one of the types that I don't know a lot about, but also very interested in. The reason I'm interested in it is because it seems to be gaining popularity very quickly. Manual lymph drainage, sometimes known as MLD, is a type of massage. I don't know much about the techniques, but it's specifically to move lymph, which, as you know, your circulatory system has your heart to move the blood around, but your lymphatic system doesn't have a pump or a heart, so it sort of relies on other methods to move it around.
Right. Just the mechanical movement of the body itself.
Even just mechanical movement of the body itself it does move it around, but as we know, people sit at desks 8 hours a day and they're not getting the movement that they require to get out with the bad. And so manual lymph drainage has come along and really is gaining in popularity with cancer patients, breast cancer. A lot of your lymph is in the breast area and things like that. And it's even in hospitals now, which hospitals don't seem to be attuned to really offering massage in too many other areas, medically speaking, but MLD seems to be gaining popularity.
You know, when I did my internship in China, massage therapy is a component of the treatment of every single disease and disorder in the hospital. It doesn't make any difference what you're going for. Massage is going to be a part of that, treatment. And, you know, it just makes so much sense, and it works so well, and it's so natural, and it is such a facilitator of wellness that I can't wait until that's integrated more. I mean, all of the techniques that we provide are like low-tech techniques that are really time proven to have a tremendous amount of benefit. It brings to mind, you know, lately they've been talking about people, if you're on a long flight, you know, they need to get up because they get this thrombus formation and embolize that can form from a long flight and just sitting in a chair. And you mentioned before about people just sitting all day long and getting concentrating in front of the computer, and getting into a tension pattern. And although they're not locked in like you would be on a plane, you could see where as the lack of circulation can cause a whole host of disorders, separate from the tension that builds up. I find that there's more tension because people are under so much more stresses and pressures. I don't know how much more work you're going to expect out of individuals in society. I can't wait till that changes around where we bring more of a balance of our work and home life into play. But as I explain to people, is that I can go like this for a long time, but I can only go like this for a little while. And after a few minutes, I'm going to start to shake. I can't hold this up anymore because I'm actually I'm not moving the muscle to bring the oxygen and the blood supply into there, but I'm working, I'm holding it. And that's very similar to the patterns that people get into for hours on a day in and day out basis, concentrating on what they're doing, and this tension is just building up. It needs to be released.
Absolutely.
So stay with us, because in a moment we're going to demonstrate all of these techniques. With us here today is Aga Baranieski, who has graciously decided to be our demonstrator model for our massage therapy techniques today. Aga is a physical therapist located in Somerset County. She does a terrific job, and Aga, thank you for coming today. Okay, Kevin, you want to show us, run us through the moves?
Yes. A very common reason people come into the chiropractic office or to get massages for neck and shoulder pain, what I call cubicle syndrome, from sitting at the desk hunched up all day. And what I usually do is, without any lotion or oil or anything, we start on the bare skin of the neck and shoulders, just doing some elongation of the muscles in the neck. Gentle enough that it doesn't hurt. A massage, really a good massage, should never hurt, but this type of deep tissue massage may not be as relaxing and soothing as, say, a Swedish massage. So we're just sort of warming the muscle and elongating the muscle slowly. And then we can do the same thing for the trapezius on the top of the shoulders here, with some longer glides.
Yeah, I think that massage and stretch is a great thing.
And then we can get much more specific, as I was saying. The more deep tissue you do, the warmer and softer that the muscle tissue gets. You can start to really dig in and try to find those trigger points that we spoke of earlier and try to release those. And that really takes a palpation skill. You really want to feel the individual fibers, feel for any tension. Notice also the facial expressions on the patient's face to see if there's any pain or tenderness in any of the areas. And of course, communication is always important too.
Well, that's great that you mentioned that too, because I think that people, if they're not used to getting regular massage therapy, don't know how to communicate with the massage therapist, on what their needs are, or how that feels, or the feedback. That's a good point that you're making.
Absolutely. Like I said, you see on TV and you see in the movies, everyone just kind of zones out and relaxes to the music, but a deep tissue massage is a different experience. You're here to improve your health, and I need to know how you're feeling. I need response and feedback. I need to know if anything's painful or not enough pressure. Sometimes a person will leave a massage saying, I feel like they didn't do anything, and that's the therapist's fault for not communicating.
Yeah.
Any pain or tenderness in any of this area, Aga? No.
It's amazing how much headaches and head pain are tension related. I remember when I had that TMJ problem, and you worked all those muscles out, and I was really in a funk for weeks with pop and the jaw, and I was doing everything I couldn't get rid of it, and Kevin got in there and worked those muscle groups out, and it was a miracle.
I was glad to help. Actually, I think I heard a statistic one time about 80% of headaches are caused by the tiny little muscles in the back of the neck. Again, a symptom of cubicle syndrome. When we're sitting at our desk typing all day, everything gets scrunched up, and the tightness in the muscle doesn't allow for good blood flow into the head, and we get headaches. So this is sort of a headache massage right here at the base of the skull, at the top of the neck, the suboccipital muscles here.
Yeah.
Spend some time loosening those.
I know, and people walk around all day, they're doing this tension type of thing, like that.
And included, again, like I said, in sports massage, but also in some deep tissue, myofascial, neuromuscular therapy. It's good stretches are a good component of a good massage, too. Never to any pain level, but you should keep communicating with Aga. Aga, please let me know if the stretch is too much. And you just do some nice mild stretches and really keep things loose and limber.
If it's okay with you, Kevin, can we take a moment out and switch to a prone position?
Absolutely.
So that we could see some of the different techniques which are easier to demonstrate on film when you have a larger skin area.
Of course, absolutely.
Kevin, let's cut to doing some of the massage therapy techniques on the back. It's great because there's a larger surface area. You could show the viewing audience really what these mechanical approaches are.
Most of the muscle groups are larger and more spread out like this, unlike the neck. So these techniques are actually what you would use in many places. But you would start, again, with just warming the tissue that you're approaching. And you can use a kneading with the back of the fists. This usually feels pretty good, but it also saves the hands of the therapist. So if a lot of the squeezing and things that you do can really be dangerous for a therapist. You can develop carpal tunnel syndrome and whatnot. So different techniques are used on different parts of the body. This one's one of my favorites. Really does a great job of warming the tissue and softening everything up. And then we can switch to one of the more common myofascial release techniques is actually used with the proximal third of the forearm or the elbow glide. What we do there is really, it's just a great skin-to-skin surface area contact, and to the tolerance of the client on the table, we do a nice slow elongation of the muscles all the way up the spine. That's not too much pressure, is it, Aga? No. You want to give enough that you're really manipulating the tissue, but you don't want to give so much that you're hurting the client.
It gives you a tremendous amount of leverage right there. That's
Excellent.
Absolutely awesome.
And do that a few times to really elongate the muscles and move the fascia, soften everything. And you can even switch directions and go the opposite way. The full length of the muscle that you're treating. Deep tissue techniques for myofascial release or neuromuscular therapy should be very thorough. You know, just rub one specific spot that hurts. You really treat the entire muscle
from
or
the
muscle
origin
group.
to the insertion of the
That's
muscle.
correct. Now from there, once the tissue and the muscle group has really been thoroughly warmed and stretched and elongated, is again where you can start to dig in using thumbs or fingertips, looking around for trigger points. And while you're doing so, you can do another technique called cross fiber friction. The fiber direction of the muscles in the back or along the spine are going sort of up and down here. And what you want to do is come in and go across those fibers. And that's a pretty common technique. Great one for spreading out the fibers, spreading them away from each other, but also a great one for palpating and looking for trigger points.
Yeah, that's exactly what I do with that. I can even see the the difference already in just what you did between the amount of tension
You can not only
in your back between one side and the other.
You can only see, obviously, your skin color turning pink with the blood flow increasing, but if you were to feel, there's actually a good temperature difference too. It's really nice and warm, and the tissue's getting soft. When I pressed right here, she did react a little bit. Maybe some tension in there, Aga? Yes? So for a trigger point release, I would really try to palpate, get very specific to the center of that tension point. Press directly on it. Again, not so much that it's terribly painful. It's not going to be relaxing or soothing. We stay there for a few short seconds, interrupting that pattern of pain. Perhaps even ask Aga to take a nice deep breath in and relax on the exhale. And I think usually you find that the pain reduces and the muscle, you can actually feel the muscle under your hands, under your fingers, relaxing.
Are there other kneading techniques that you use mechanically?
Yes, there is a common one in Swedish massage and in knee tissue is called petrissage. You're sort of pulling on the muscles. This one's much more common in the Swedish because when you have the oil, it really feels, or the lotion, it really feels wonderful. But it's a good one for deep tissue as well because you're really pulling the muscle away from the bones and the attachments and things like that.
I think especially nowadays with people having fibromyalgia and stuff like that, just that kind of rolling, you know, skin rolling and getting that separation of the tissue like that is a real good idea.
Anything you can do in an effort to break up adhesions in the fascia and the collagen and whatnot in any and every direction you want to go, north to south, east to west.
You know, they're finding in a lot of autoimmune disorders that mess with the connective tissue. Just getting this type of massage on a regular basis too helps it so that it's not necessarily curative for the underlying problem, but slows down the progression of the disease and disorder. You know, just very similar. I see a lot of patients with MS, and we do a lot of deep tissue massage into the nerve junctions of the legs and into the upper portion of the buttocks that really help to alleviate their symptoms. What I was telling before was that with the diabetic patients, they have this peripheral neuropathy, and just getting that massage to mechanically increase that circulation into there is so important to do because the sooner they start, the longer, the further they're going to push out the eventuality of having, any long-term feet or hand problems, and it's just so important.
Absolutely. I hope we are demystifying, as you said at the beginning, for some people that massage therapy, good massage therapy, modern day massage therapy is not just a frivolous thing that we do on vacation once a year for pampering.
On a cruise or something like
this
that.
is exactly. This is really can be a very integral part of a healthy regimen.
Right. Well, I want to thank you for coming today and spending your time and showing this, and I hope that for the viewing audience you take some of this to heart and realize that this is a very good investment of your time and resources, and it has a tremendous amount of health value. For Somerset County Alternative Medicine and Natural Healthcare Alternatives, I'm Dr. James R. Golding, and thanks for viewing.